It's September 2nd, and we're going to talk about cervical cancer. It's my favorite. I'm just kidding. It's not my favorite at all, but that was the kind of cancer that I had. Cervical cancer is cancer of the cervix. That's the lower, narrow part of the uterus that connects to the vagina. And the most common cause of cervical cancer is human papillomavirus, or HPV. It is an STI, but it's not the only reason people get cervical cancer. As a matter of fact, 2-time cervical cancer survivor here do not have HPV. Regular pap smears are crucial for early detection and preventing cervical cancer. Make sure that you get your pap smear every year if you possibly can, and every 3 years as is recommended by the quote-unquote authorities at this point. It can affect anyone, but it's most common in women ages 30 to 55. Symptoms of cervical cancer can include abnormal vaginal bleeding, unusual discharge, pelvic pain or discomfort during sex, as well as lower back pain, abdominal issues, gastrointestinal issues, all the things that women suffer all the time anyway. So if you think something's wrong, make sure you push your doctor to find out what's really going on. Treatment for cervical cancer depends on where you are in the disease. My personal story was I had a radical hysterectomy and then 2 years later had a recurrence and had to have radiation and chemotherapy. The best way to prevent this cervical cancer is through regular pap smears and an HPV vaccination. It's recommended for girls and young women before they become sexually active, but make sure it's right for you. We'll be back tomorrow with more information on gynecological cancers.